Hello friends, as you all know that patients with diabetes are prone to injuries, ulceration, which leading to foot problems and end up in foot loss. Today I would like to share information regarding the factors or the causes which cause these problems in diabetics. There are two main important entities. The first is the diabetic peripheral neuropathy. The second one is the peripheral artery disease. So now let's see this both one by one. The first component, that is the diabetic peripheral neuropathy. It means damage to the nerves that is supplying the feet. So based on the types of nerves, it can be of three types. The first one is the sensory neuropathy. It means the nerves that are supplying the sensation get damaged due to diabetes. Sensations like touch, pain, temperature, all this gets damaged, and as a result of this, if there is any injury, it is not recognized at the earliest, which leads to infection and then will end up in foot or even limb loss. The second is the motor neuropathy. Motor neuropathy, as the name suggests, it involves the nerves supplying the muscles. As a result of this, there are certain changes in the feet, shape changes like a clawing of toes or hammer toes, or they can be pressure changes below the feet, leading to corns and calluses under the feet. The third variety of neuropathy is the autonomic neuropathy. Autonomic neuropathy involves many organs, but in the feet, it involves the sweat and oil glands, leading to dryness of the skin below the knee and also will lead to cracks in the heels. As you all know, that majority of the patients who have diabetes will have at least a small amount of neuropathy, but they are not aware because majority of it is asymptomatic. Only a few will have symptoms like tingling sensation, burning sensation, pins and needle sensation, or even numbness can be present. Few patients complain that these symptoms are very disturbing and they are not able to carry on with their routine activities. And these symptoms especially appear when they are going to the bed. One more important thing I would like to tell you is once this neuropathy has set in, it is very difficult for it to be reversed. 90% of diabetics of more than 8 to 10 years duration will have this neuropathy. Now let's move on to the next, that is the peripheral artery disease. Peripheral artery disease means the blood vessels are involved here and there is a clogging within these blood vessels which supply blood, leading to decrease in the circulation and as a result decrease in the oxygen supply to the tissues, especially the feet, which will lead to death of the tissue, which may be precipitated by a small injury, and the dead part will become blackish, and in medical terms we call it gangrene, which is a very popular term among the general public. It means nothing but the death of the tissue. Once the gangrene has set in, it is again irreversible and will require appropriate treatment. So these are the two main reasons why diabetic patients develop foot problems, and there are certain things that need to be done to prevent these problems, which I will be discussing in my coming videos. That's all for now. Thank you for watching. For any queries, please comment below or you can contact me. Thank you very much.